The key changes include using early warning scores like News to Muse and SIRS score instead of Q's of a score, because Q's of a score has the least sensitivity, and administering antibiotics within 1 hour for septic shock and probable and definitive sepsis even with the shock symptoms present, and pre-hospital antibiotics administering less within the 1 hour in the field, and use of balanced crystallized over normal saline 30 ml per kg over 3 hours. If the BMI is more than 30 kg per meter square, we have to calculate as per the ideal body weight. And the conditions where normal saline is used is in during the traumatic brain injury or hyponatremia, and prolonged beta lactam infusion, which is a strong recommendation, as this beta lactam infusion is a time sensitive antibiotic, so prolonged infusion causes the effective minimum inhibitory concentration values. And this new mean arterial pressure targets for elderly patients over 65 years is between 60 to 65 mmHg, so that it reduces the vasopressor exposure without increasing the mortality. And selective decontamination of the digestive tract, it is conditionally selected for the patients who are mechanically ventilated and neonates with low multi-drug resistant organ prevalence, because this digestive tract, these anaerobic organisms which are present are thought to cause multi-drug sensitivity, so they are doing selective decontamination of the digestive tract. And active fluid removal after acute resuscitation phase. Once the vasopressors are stable and the resuscitation is complete, use of diuretics to remove the excess fluids, and then de-escalation of the antibiotics after confirmation with the microbiological diagnosis and susceptibility profile is available. And this surviving sepsis guidelines focuses on long-term recovery, where there is a post ICU care, where after the discharge of the patient there is physical rehabilitation, mental health support, and cognitive follow-up. And here the dynamic assessments for the fluid responsiveness are more concentrated than the static ones. And these are the few infographics I found helpful. The first thing, like we are rejecting the, we are not taking into consideration of a Q's of a score as it is having a low sensitivity, and now we are considering the early warning scores and the trigger bedside evaluation and not replace the clinical judgment. The 1 hour bundle, measure the lactates, remeasure if more than 2 millimoles per liter to guide the resuscitation, and blood culture must be sent and it must be obtained before the antimicrobials.